Hello, this is Dr. Chetan D Deshmukh, medical oncologist, Dinanath Mangeshkar Hospital and Research Center, Pune. I'm here to talk about head and neck cancer, which actually is an increasing problem in the past few years. If you can see the types of head and neck cancer, which I'm going to discuss in a little more detail in the next few slides to come, you see the types, that is lip, oral cavity, oropharynx, that is the throat, larynx, that is your voice box, nasopharynx, that is the area behind the nose, hypopharynx is the area below and behind your voice box. These are the different types of head and neck cancers. And if you can see the incidence of new cases, it's rather high. You can see lip and oral cavity has already crossed a lakh. And the more disheartening aspect of the whole thing is the number of deaths. You see a huge number of these patients eventually die of their disease, which is really very, very sad. So the incidence is about 9 per 100,000 people. There are certain cancers which are more common in certain aspects of the country, like nasopharyngeal cancer is more common in Nagaland and the other northeast states. But that is for a later discussion. What I want to bring to your notice, this particular pie diagram. If you see, this is the total number of cancers which are diagnosed, of which obviously breast cancer is the commonest cancer. 1,78,000 women getting diagnosed with breast cancer every year. This was Globocon 2020 data. But if you see the oral cavity and oral cancer number is also gradually creeping up. It is already 1,35,900 plus, which is about 10.3% of all these of the entire cancer population. It has already surpassed uterine cervical cancer. So uterine cervical cancer is 1,23,000. The oral cancer is 1,35,000, which is a rather high number. Compared to that, lung cancer, colorectal cancers are much less in the hierarchy. And of course, the other cancers make up the large majority, that is 56.5%. So oral cancer continues to be a major issue, especially for our Indian population. So what constitutes head and neck cancer, or the broader term, oral cavity being just one part of it. So if you can see the slide, the oral cavity is the one which houses the tongue, and that has your gums, your teeth, the lining of your cheek, and this part is the commonest site of cancer in Indian population. You also have carcinoma of tongue, carcinoma of salivary glands, carcinoma of the oropharynx, that is the part which is the throat, or the area which is behind your mouth. Nasopharynx is the area behind your nose. This is the nasal cavity, and nasopharynx is this part which is behind the nose. Oropharynx is this part which is behind the throat, and which is the throat or the area behind your mouth and tongue. And hypopharynx is that area which is behind and below the voice box or the larynx. So these are the common regions of head and neck cancer. And obviously that brings us to the next point as to what are the risk factors for such a troublesome cancer. The commonest risk factor is actually the one which is most avoidable, that is tobacco abuse and alcohol abuse. So we see tobacco used in various forms in our country. You have cigarettes, you have BDs, you have snuff, you have chewed tobacco in the form of gutka and zarda and khaini, which is kept as a quid in the mouth. Hookah is something which is coming up in fancy coffee shops, and that is another worrisome trend, because though the amount of tobacco in hookah may not be as high as a cigarette, but it is a good way of these people to get those customers hooked onto tobacco. And from hookah, then one gradually graduates to cigarette smoking, and that is an addiction which is one of the toughest to quit. Remember, the quit rate of tobacco chewing or smoking is about 7 to 8%. It means if 100 people decide to quit tobacco, only 7 or 8 people will successfully quit tobacco. The remainder will not be able to quit tobacco on their own. So this becomes a major problem, and the tragic part is this is entirely preventable. Tobacco is such an entity which does not provide you with any useful ingredients. It has no vitamins. It has no nutrient products inbuilt in tobacco. It just gives you a kick. It just gives you a feeling, transient feeling of a kick. And that for that kick, a lot of people, especially the younger population, fall a prey to this deadly habit. And then later on, they develop various health related issues, cancer being one of the most common ones and the most deadly ones. So tobacco is of course bad. Some people believe that alcohol does not have a problem with the oral cavity. That is not the case. Alcohol is an excellent solvent. So people who consume alcohol and tobacco, the the cancer producing ingredients of tobacco get dissolved in alcohol and they mix all over the oral cavity. And that is how the entire region becomes prone to develop cancer. In our medical terms, we call it field cancerization. It means that the entire field becomes prone to develop cancer. The fallout of this particular entity, field cancerization, is suppose a person has cancer on the right side of his mouth. The person undergoes successful surgery and other necessary treatments. That is great. But his left side is also prone. So he may develop cancer on the left side at a later date. So not chewing tobacco, not using tobacco and alcohol is the best way to prevent, because once you've started using tobacco and started using alcohol, the entire oral cavity gets cancerized and becomes prone for developing cancer. That is why it is such a deadly disease. And of course, another tragic aspect is, if you see, many of the young population gets hooked onto tobacco in various forms. Either they start smoking cigarettes because their parents smoke, or their peers are smoking, or some of their friends, or they idolize film actors who smoke, who are shown to smoke cigarettes. And that is how they start smoking or start chewing tobacco in some form. And once they get hooked onto it, the demand for tobacco goes on increasing. Tobacco has this unique property that tobacco gets metabolized very faster. It gets digested very fast in our body. And tobacco induces your other body systems to digest it faster. So today, if you get a high with just one cigarette, after a few days, you will not get that feeling with one cigarette. You will need 2 or 4 cigarettes. So the consumption of cigarette goes on increasing. And that is how the dose of carcinogenic substances goes on increasing. And these kids, especially school-going kids, if they fall a prey to it, they are likely to develop cancer in their 20s or 30s or even early 40s, which is actually a year when they should be focusing on their career and having a good life in general. But that is a time when they have to battle this deadly disease and undergo various disfiguring treatments. So this is one of the commonest and the most important risk factor for oral cancer. The reason why I'm harping so much on oral cancer is because this is essentially preventable. The other things may or may not be preventable. Like, for example, if you have viral infections like human papilloma virus or Epstein-Barr virus or herpes simplex virus. Now, these viruses, you have seen for the past 2 years, we've been battling COVID, and you know that coronavirus was a virus. You never knew how it came. You never knew how it affected you. And in spite of all precautions, there were people who still got it, and there were some unfortunate people who also succumbed to it. So viral infection is, these viruses are very easily transmitted, and that is, these viruses can produce oral cancer in quite a few patients. So what are the symptoms? The typical symptoms, if you have an early stage disease, then it begins as a white patch on oral mucosa, that is the lining of the cheek. You can see that on the left hand upper corner. Sometimes it actually causes a lump in the oral mucosa or the lining of the oral mucosa. If it is too advanced that it has gone to the draining lymph nodes, then you will develop swellings in the neck as well. There are other rare symptoms. Sometimes you will get blood-stained nasal discharge. Sometimes a person may have double vision. There may be unilateral headache only on one side. Some people feel the globus pharyngeus, that is the feeling that there is a lump in the throat. Something has got stuck in the throat. Some people continue to develop sore throat, repeated attacks of sore throat. Some people have pain in the ear. These are usually seen in cancers of the throat. Some people, if the cancer is large enough, then there will be difficulty in swallowing. Some people will have a long-lasting sore throat, which will just not go. Some of them develop ulcers on the lips. And as I said, in rare situations, you may develop swellings in the neck. If the disease has produced a swelling in the neck, it means that the disease is far too advanced and it cannot be tackled only by treating the oral cavity. For some people, there may be dysphagia, there may be hoarseness of voice, and in some people, the patient may just present with very severe weight loss. So these are some of the precancerous lesions where you see there is a red patch on the tongue or a white patch on the tongue. These lesions are called erythroplakia or leukoplakia. These are warning signs. So if somebody gets erythroplakia or leukoplakia, it means that the person is just one step away from developing cancer, and if he does not take care of his health, then he is likely to develop oral cancer. So how does one work up an oral cancer? Now, there's a long list of investigations and things to be done, but if you see, most of them are simple things, and most of them may or may not be required. So, of course, you need to take a proper history, make a good physical examination of the head and neck. Physical examination of head and neck is very simple. All you need is a good light source and a mirror. If required, then you may have to do certain biopsy, that is removing the piece of the affected part, and send it to the pathologist for assessing what the problem is. You may need to do a CT scan or an MRI scan. Depending on the location, you may also have to do a nasopharyngoscopy to find out if there is a tumor lurking there. If you feel that the tumor has spread at multiple locations, then you may need additional investigations like a PET CT scan or a CT scan of the chest, and so on and so forth. So once you have done the diagnosis, once you have assessed the patient, and once you have decided to go ahead with treatment, then the next step is to find out what is the stage of the cancer. So if it is remained only at one part and it is in a very early stage, you also have something called stage 0. It means the cancer cells are within the lining of the mouth, they have not spread. This is the best stage to diagnose cancer, because the surgery required for this cancer is a very small surgery, and the chances of cure are excellent. If you have a slightly bigger tumor, it means that the cancer is 2 centimeter or smaller than 2 centimeter, but it has not spread to the surrounding areas. It means that it is a stage 1 cancer, and essentially these again are treated with surgery, and again they have an excellent chance of cure. If it is stage 2 cancer, it either means that the tumor is more than 2 centimeter, or it has gone a little more deep. It has gone up to 1 centimeter deep inside the lining. Now, these tumors can be a problem because the extent of surgery is going to be a little more. If you have an even bigger tumor, a T3 tumor, which is more than 4 centimeter, or there are other places it has gone to the neck nodes, then it means that the cancer is in stage 3 disease. If you have a stage 4A disease, it means that the tumor has almost burst open and it has come out on the surface, or it has affected the jawbone, or it has affected the sinus bone, or if it has caused spread in the lymph nodes as well. So stage 4 disease means it's a bad situation. The chances of the tumor being resectable or whether surgery is feasible or not is extremely difficult to say. Sometimes you may not be able to operate on such patients. You may have to give them chemotherapy to reduce the tumor and then go in for surgery, or in some cases, chemotherapy may or may not work. You have to send a patient only for radiation therapy. The chances of cure go down as the stage goes up. So stage 0 or stage 1 has excellent chances, almost 100% chances of cure, but stage 2, 3, 4 onwards, the chances of cure go down. And for stage 4 cancers, usually the tumor is not in a curable stage and it can come back very soon. So what are the treatments of it? Forget about the pictures. The picture may look a little scary or a little ghastly, but the basic concept is, if there is a diseased area, it has to be removed. So for the diseased area, removal of the tumor along with the surrounding, a slightly normal area in the surrounding also has to be removed. And this is accomplished by a good surgical procedure. If surgery is done, then most of the job is done. If you can operate the tumor completely, then that is a very good job. Sometimes you may need to fill up the gap which you have created as a result of surgery with some plastic surgery. Now that depends on where the tumor is and what kind of tumor surgery has been done. But some patients may require additional plastic surgery. Some patients will not require any additional surgery, and their regular wounds can be healed in the routine fashion. So this is the mainstay of treatment. If you have an early stage tumor, then surgery is the best treatment for those kind of tumors. Radiation therapy is often given after surgery to make sure that the tumor does not come at the same location. It can be both external beam, that is radiation therapy given from a distance, or it can be brachytherapy. You can see the image on the right hand side. A patient is undergoing tongue brachytherapy, where those electrodes are put inside the tongue, and high dose radiation therapy is given to these people. Chemotherapy is actually the use of drugs or chemicals to destroy cancer cells, and these are given either in the form of injections or tablets. The very fact that somebody requires chemotherapy means that the tumor is a little too advanced and is not in a position to be removed surgically. That doesn't sound good, because generally tumors which are big enough not to be operable usually have a very poor outcome. So chemotherapy is not the commonly used therapy. It is used only when other therapies are not feasible. An additional type of chemotherapy which is coming up recently in head and neck cancer chemotherapy is the use of immunotherapy or immune checkpoint inhibitors. These are interesting drugs. They don't kill the cell per se. They activate your own immune system, your own resistance power, and this resistance power becomes strong enough to kill the cancer cells and get rid of the cancer cells. The side effects become very, very less compared to the side effects of chemotherapy, which are sometimes really very terrible. So the best thing is prevention. Somebody said that prevention is better than cure, which is 100% true, especially in oral cancer, because most of the oral cancers are associated. 90% of oral cancers in India are associated with tobacco and alcohol. So avoiding tobacco and avoiding alcohol are the simplest ways of avoiding oral cancer. Now, HPV infection, you may or may not be able to avoid it, but avoiding tobacco and alcohol is the simplest way of doing it, especially for a resource constrained country like India. We are not in a position to do repeated viral checkings. We are not, HPV vaccine is still in its infancy about oral cancer. We still don't know whether it can be used for oral cancer. The thing which you can do at your level is avoiding tobacco and avoiding alcohol. That's the best and the easiest, simplest, and the most cost-effective way to prevent oral cancer. Apart from that, if you maintain a healthy weight and make sure that your diet is rich in fruits, vegetables, raw, especially raw fruits, raw vegetables, salads, and other nutritious things, then that is also going to help you prevent oral cancer. So tobacco, as I said, I keep harping on tobacco. That is the simplest. Other things may or may not be easily done. Early detection, there is a concept of oral self-examination or mouth self-examination, which was propagated by an institute in Kerala. It has been taken up at some places, though not as popular as mammographic screening, but it is essentially something to be done by the person himself. All he has to do is stand in front of a well-lit mirror and examine his oral cavity from inside. If there are any small lesions and any small patches which are reddish in color, whitish in color, or small swellings inside the mouth, they need to be reported as soon as possible to detect the cancer in a very early stage. Thank you.